Hi, this is Dr. Martorell. Today's topic is going to be DoxyPEP. A lot of people asking about it. So DoxyPEP is doxycycline post-exposure prophylaxis. It is an antibiotic. Doxycycline is an antibiotic for treatment of many infections, and it can also be used now after sex without condoms or other barrier protection to prevent bacterial infections, meaning Chlamydia, Gonorrhea, and Syphilis. This antibiotic can also be used for treatment of Lyme disease, acne, rosacea, MRSA, skin infections, many infections. So research trials and real-world data have shown that DoxyPEP reduces the risk of these infections by about 2/3 or 65%. So it is not 100% effective or protective. This data is in men who have sex with men and transgender women who have sex with men. It could be used or prescribed in other patient populations, but I just presented where the data is mainly focused on. So the benefits of DoxyPEP are in preventing these 3 infections in people who may have sex without condoms or barrier protection. Many people who take or use DoxyPEP for sexually transmitted infections report a decrease in the anxiety and stigma related to sexually transmitted infections. In some people, it can be empowering, and it may facilitate a sex positivity and allow individuals to take care and be in charge of their own sexual health. So what are some of the risks of doxycycline? Some of the side effects may include allergic reactions and also photosensitivity, and that means sun sensitivity. So people may need to apply sun blocker and cover themselves to prevent that particular side effect. It may also cause gastritis or inflammation of the esophagus and stomach and nausea in some situations. Antibiotic resistance may be a concern, and because the person is taking an antibiotic, it may change the gastric flora or the bacteria that is normally found in people's gut. So how is DoxyPEP used? So DoxyPEP is a prescription. Doxycycline in this setting should be used as a 200 milligram dose, ideally within 24 hours, but not later than 72 hours after condomless oral, anal, or vaginal sex. Should be taken with a glass of water, upright, and it should be taken with food to prevent some of the potential adverse events. Do not take more than 200 milligrams per day, and it can be taken as often as daily if needed, depending on the sexual activity. Doxycycline is an antibiotic that can be used to prevent some sexually transmitted infections. Just keep in mind that this one will not prevent HIV, and it will not prevent other viral infections. For HIV prevention, there is PrEP, and I will be discussing that topic later. Well, if you like this topic, like my social media pages and follow me. Thank you.